Hello.
Okay, they can. This is the.
Good morning.
You want. Good morning, Sorrento. So she made it to her desk. She may be the one, maybe able to turn it up.
Speak so that way I know we can hear.
Sorrento, can you say something?
Yes, good morning.
Okay, hold on one second. We're trying to make sure the room can hear you. Is a
I'm gonna
speaker-
head out anyway, so just go ahead and get started.
Is this is the speaker for the online?
Yeah.
Okay.
So you know, you always the bread.
Good morning, everyone. If you guys can take your seats and quiet down, we're gonna go ahead and get started. Okay, so Rachel, can you hear us?
I can hear you.
I don't know if you guys can hear Sorrento. Can you guys hear Sorrento?
Good morning, everyone.
He's saying good morning, everyone.
Are they able to hear me, Sheree?
Minimally.
Okay, so
Here.
with minimal hearing, I'm just gonna say really quickly, good morning, everyone. I wanted us to go ahead and get started with the meeting. I did need to start my day here at the office. I do have a new staff member who's standing to my right, who started today. But we are going to go ahead and head over to Truman College, so we're gonna see you shortly. But I wanted to welcome everyone and thank you again for taking time out of your day to spend time at Truman College and at another one of our EDPD stakeholder meetings. I know there's a lot of information that we want to share, so I'm not going to hold us up because of time. Just thank you again, and I will see you shortly. Thanks, everyone.
Sorry about that. So, good morning. What she said was, hi, everyone. That was Sorrento. She said that she was at the office because she had a new hire that started today. So she had to be there to greet our newest new hire. And she said, since you guys can't hear her, she and our new hire, James, will be making their way here to Truman. So you will see her shortly. Thank you, everyone. That's what she said. So good morning. How is everyone? Oh, I am touching the screen and she told me not to. Ooh, is that me? That wasn't me, it was the mic. Don't look at none of this stuff. Don't look. Okay, there we go. Good morning, everyone. My name, I like holding it. My name is Sheree Johnson. I am the manager of program operations and quality, and we welcome you to our December EDPD. Can you give yourselves a round of applause for making it today? You made it safely. The sun is shining. I'm happy. We have these fancy breakfast boxes. So anyone who is not here and you're listening in, you're missing a fantastic breakfast box. But we're going to go ahead and dive into our agenda because it's kind of heavy for today. Typically, for those of you who normally join us, you know that Sorrento normally kicks it off with her updates. But since she's not here at the present moment, we're going to save Sorrento to the end. You guys should have your agendas in front of you. So you'll see that I'm up first. So as we know, we have new arrivals here in the city of Chicago. We also know that they go by multiple names. So here at DFSS, we have labeled our new arrivals as new arrivals. If you're working with CPS, they are labeled as newcomers. And if you're working with anyone else, they may call them migrants, immigrants, visitors, what have you. But here at DFSS, we have labeled anyone who has decided to come here to the city of Chicago as a welcoming city. They are dubbed as new arrivals. So this is the standing slide that has been provided for you all. I know a lot of you have asked questions regarding how you can support the new arrival mission. If there's anyone who would like to donate any particular items to a shelter, We'll talk about shelters in a moment. If there are any particular items you'd like to donate to the shelter, such as bookshelves, Spanish language books, or any other materials for actual shelter settings that will stay in shelter, you are welcome to direct those inquiries to me. My information will be on a slide coming up. But if you would like to donate any clothing items or anything that you would like to purchase for any of the families, we do have Amazon wish lists that are available. We also have multiple agencies that are accepting donations on behalf of the New Arrival Mission, and they will ensure that those items are properly inspected and then given and distributed to families who are in need, who are also not only new arrivals, but for our own in need families that are here in the city of Chicago. Additional information can be found at that link that you see there on the screen. Does anyone have any questions regarding this information on this slide? All righty, next slide, please. So here, I've provided for you all the list of what's on this slide are 16 family shelters, okay? So for the New Arrival Mission, DFSS facilitates 25 shelters. Of the 25 shelters, 16 of them are family shelters. The other shelters are single individual shelters. So for the sake of today, for the sake of early learning, we are only going to talk about the family shelters. So we have here on the far left, shelter name. Again, the population is for families. We have the addresses for each of these shelters, the community area, and then we have the age of, or the number of children according to age 0 to 5. And this information was gathered as of the 1st of December. And we also began to track the number of pregnant women that are in shelter as well. So as you can see here, we have 738 children aged 0 to 2 that were in shelter as of the 1st of December, 1,175 children aged 3 to 5 that were in shelter as of December the 1st, and 155 pregnant women in these family shelters as of December the 1st. Now, again, these are only the shelters that are facilitated by DFSS. We know that there may be a number of other shelters that are supporting the mission, but I am only at liberty to report out regarding DFSS facilitated shelters. Though we have provided the addresses for you all, I encourage you all, unless you already have a relationship with the shelter, meaning that myself or my colleague, William B.J. Lohr, has introduced you to the shelter staff, we ask that you don't just show up at the shelter. For safety purposes, they will not let you in, even if you come and say, hi, I'm from Sheree's Daycare. I work with DFSS. I know Sheree, yeah, Sheree, yeah, They're not gonna let you in. For safety, we know a lot of folks have been coming to shelter just to support, which is great. They've also been coming to try to get the latest scoop. So we've had folks try to show up just to get a camera and go in and see, look at these conditions. We've had other folks who may come portraying themselves for services, but we know human trafficking is real. And we've also had folks who just come just for, I don't know, just to be nosy, I'm not sure. Or the folks that many people are running from have also shown up to shelter. So again, just to keep all the residents safe, to keep all the staff safe, and to keep yourself safe. We ask that if anyone would like to support the New Arrival Mission, if any of you would like to enroll any families at any of the shelter locations, reach out to me so I can ensure that we are of support to you and your staff at the shelter, as well as to ensure that you guys are able to actually get into shelter. We do know that some of you have gone to shelter locations and you've stood outside, with your materials, you have things that you give to families, and that's fine, if the families, they don't necessarily stay indoors all day. So some of them do come out, so if you want to go to the shelter just to see what you can do from curbside or right outside the door, you're welcome to do that, but we're trying to keep efforts orchestrated as best as possible. So I just ask again, if you are interested, just let us know, okay? Does anyone have any questions on any of this information? I'll ask a question on myself since no one's asking. Why is it highlighted? Why is that one? What is that? Casa Esperanza? Why is that highlighted there? I'll tell you. What we've been promoting is that we have 15 family shelters, but if you count, there are clearly 16. The 16th shelter, which is that highlighted one there, is Casa Esperanza, is very small. Okay, it's so small, in fact, that families typically don't stay there long. And as you can see, there are only 2 0 to 2-year-olds, 1 3 to 5-year-old, and there are 20 pregnant moms. So oftentimes, you know, for us to send recruitment efforts there, it may not be the best bang for the buck per se, because it's so small that if those families were in need of any additional support, we can send them elsewhere for that support, which is why we typically don't promote that individual shelter, but there are 16. So when I have conversations with you, we're going to say, oh, there are 15 family shelters. In essence, really, there are truly 16, but that 16th one is really, really tiny. Are there any questions? Is this making sense? Great. So let me give you some data that we've gathered thus far. So as of October 2023, I've reached out to a number of you. I've asked on your own, how many families have you recruited that are deemed as new arrival? Some of you have been coming into the shelters to do some recruitment. So as of October, we recorded 217 enrollments. Through your fantastic efforts during the month of November, we were able to do 301 additional enrollments. So please give yourselves a round of applause, because I appreciate that. Every little bit helps. Even if it was one enrollment, you know, that's one additional support that we're providing to new arrival families in shelter. So as of December 1st, we've recorded 518 enrollments. And that number has grown because we have a number of agencies we have an agency who has an event scheduled for this Saturday. We have another agency that has an event coming up on a weekend. So bless you. You know, so enrollments continue to occur, but again, if anyone is interested, my email address is there. I also would like to say that new arrival family enrollment, though it is a supplement to your overall enrollment, it is not the answer. Reason being is because families are transient, right? So they're not going to be here for very long. Has anyone heard about the 60-day mandate for shelter? How many have? Can you raise your hand for me? You know, I'm visual, I like interaction. Who hasn't heard about the 60-day mandate for shelter? It's okay if you haven't. I appreciate, I see, very good. Look at that hand up walking with her coffee. Good, very good. Very good. So let me tell you what that means, okay? So prior to December 1st, what would happen is a family would come in, the buses come to Chicago, they arrive at what is called a landing zone. And the landing zone was police stations, okay? Once they get to the police station, they're given a specific number, which is called an SR number. It's just a particular assignment number that follows that individual while they are in the shelter system. Once they are assigned that number, they are then placed in shelter, and then they're in the shelter until further notice, right? But as of December 1st, there is a new 60-day stay for anyone that's in shelter, right? So anyone who arrives in shelter after December the 1st, they get the SR number, they go to landing zone and all of that. But once they're in shelter, they are given a notice that says, your name is Sheree Johnson. You will be given 60 days to stay at AIC. That's one of the shelters, right? So I'm Sheree, I'm a new arrival. I was assigned to AIC. I also received a notice saying that 60 days from this date, I will be vacated from the shelter. But that notice will also tell them what services that family and supports that family or individual will receive. So the goal is to have that individual be linked with some type of workforce support. That individual also receives some type of medical intervention if needed, additional services, potentially legal services, and they will also be placed in housing within those 60 days, okay? Ideally, so in 60 days, those individuals will receive their placement in housing, and they will be vacated from the shelter, affording additional space for any additional new arrivals who need housing temporarily. If there are individuals who are in shelter who may have a condition, a medical condition, or the child may have a medical condition where they should not be displaced right away, that 60-day notice can be extended. So 2 weeks prior to their 60th day, they will receive a notice that says they have been extended, and that extension can vary depending on the need. There are some folks who need an extension simply because their housing is on the way, but it won't be available by the 60th day. It may be available by the 70th day or something like that. So if housing is soon to come, they will be given an extension so they won't be displaced from shelter with nowhere to go. So the question becomes, so what if they don't have housing? Does anyone want to ask me that question? It's okay. Go ahead, ask me. Oh my goodness, that's a fantastic question. What if they don't have, thank you for your diligence, right? What if they don't have housing? What happens? So as best as we can, DFSS is supporting families to get them into housing. Housing typically comes from Catholic Charities, right? And if in the event that housing is not available for that individual, they have not been granted an extension, they don't have any circumstances that affords them the opportunity for an extension. If by the 60th day they do not have housing or placement, they are still displaced from that shelter, and they will have to start the process all over again, which means they're going to return to a landing zone so that based off of the SR number, they can be reassigned to another shelter location. Now, as best as the team can, because lots of folks said, well, that's crazy. You know, what if I work for Lakeshore, right? You're an educator from, good to see you, an educator from Lakeshore. She's worked with a family from a shelter. They've enrolled the family. The family is at Lakeshore Hotel, right? And at Lakeshore Hotel, she's been, you know, keeping this 3-year-old who's enrolled in her program. But the family, they've reached their 60th day. The family is now displaced, gone back to landing. And now instead of being placed at Lakeshore Hotel, the family is now at Inn of Chicago, right? Lakeshore Hotel is in the Kenwood neighborhood. Inn of Chicago is downtown. So it's highly unlikely that that 3-year-old is going to return back to her program, right? Because of the reassignment. I just need everyone in this room to be clear on that, okay? This is a heavy lift, we know. We know that a lot of the families are transient. We know that due to the 60-day mandate that you may have children who literally will be enrolling and dropping and enrolling and dropping. And that's the reality that we are in, not only with new arrival families, but with any homeless family that you're serving, right? But that is the 60-day mandate that's currently happening in shelter. Yes, ma'am.
We can follow them throughout the day.
Yes. Correct. Let me try to surmise what you just said for those who can't. Okay. So her question was, is it a possibility, or is this just for DFSS facilitated shelters, or does this also include suburban shelters? Because the fantastic thing about home visiting is, as you know, home visiting can happen anywhere, right? But the struggle is that once they leave the city of Chicago, it's beyond your service area. So, you know, what can we do? Are we basically working with other shelters beyond city of Chicago? And the answer is, in short, that yes, DFSS facilitates our own shelters, right, for families, for new arrivals. We also have shelters that we also facilitate for our own homeless. So there's a separate system of shelter that we are also facilitating here at DFSS. We also know that there are a number of other shelters within the city of Chicago, as well as outside of city limits, that are also supporting new arrivals, right? But the biggest thing I want you guys to be aware of is that no family is balled and chained. Just because they have an SR number, we've placed them in Inn of Chicago or whatever other shelter, they are free to go at any time, right? So even when you do your best effort for whatever your program model is, home visiting, what have you, you can't make a family stay. So we have a family right now who might be on the list waiting for housing, but then out of the blue, that family just disappeared. They left. And they may have gone outside of city limits. They may have gone to Philadelphia. They may have gone to St. Louis. I don't know. But as best as we can, we're trying to keep up with families to ensure that they have those supports. And when they do notify us that, you know, they'd like to relocate to X, Y, and Z, we have case managers that are in-house at each of the shelters who are trying to keep a handle on all of that information. They're reporting it back to shelter leadership, who are then reporting it back to DFSS leadership, and then we're working on extending collaboration. So just because the list currently is 16 family shelters, that won't remain. When I first joined this mission to support new arrivals, there were only 9 shelters, and now we're up to 16. So it's kind of hard for me to say specifically an answer to your question because it's just really a transient situation. And I hope that was semi-helpful. Yeah. Are there any other questions? Yes. Mhm. So let me repeat the question. Our families are families at liberty to find their own housing because there are certain agencies who are, as best as they can, trying to support families who they've enrolled through the new arrival mission, trying to support them with finding housing near their center so that the child won't be displaced from their enrollment. And then she also asked if there's some type of agreement that new arrival families have gone through with landlords to support them staying at residences outside of what City of Chicago has a system with finding. And I said all that to say, I don't know, Tracy. I'm gonna write that down though. Can someone write that down for me, please? I'm not sure. I do know, again, no one is mandated to stay. You're not mandated to take the housing that is provided to you. If you have other means, then by all means, you're welcome to take that. We are in the United States of America. You are free. You are free to do what you are at liberty to do, right? So if you find your own housing, kudos. That's fantastic.
And whatever program is there is going to help them, like, okay, as long as they are able to continue paying rent after, I guess, they get the landlord money, but there wasn't no documentation in the case.
That could very well be the case. She said one of the families that her program has worked with at Broadway Armory was told that on her own, she found housing, and then because of the type of housing that it was, they were able to accept payment that the city was supporting. So that makes sense. So for instance, if the same would apply if someone were to receive a HUD voucher, right? If I receive a HUD voucher saying that this voucher will cover my rent for me for X amount of months or what have you, but in order for you to use that HUD voucher, it has to be through a landlord that accepts HUD. That's the same thing. So if Catholic Charities is finding housing and providing support for rent, right? Rental supports. Then if you have another landlord, that landlord should be able to take the same rental support that Catholic Charities is also providing, right? So it's the same thing. Yeah. Very good question. Any other questions? Comments, concerns? Okay, I think that might be it for me. Yes.
Those sites who are maybe under-enrolled or under this plan, and they are getting a lot of transition. I just like you gotta have people enrolled, but then once a month you time to take children. Have to be ready, or they're gonna be getting concessions for this.
That's a very good question.
People feel like they don't necessarily want to take more life because they are not.
Right. So her question is, how does this impact enrollment? I'm just gonna summarize. How does this impact enrollment, especially for programs that are striving for 100% enrollment? And as I stated, families are transient, and if a program is funded for 100 slots and you have 100 slots filled, but then out of the blue, 40 families drop because 40 of those families were new arrival? How does this impact overall enrollment? Are the powers that be considering this, especially when we are talking about striving for full enrollment? And I have my answer and I don't have my badge on, but if I have my badge on, I'm gonna say that we should not be refusing any family that is homeless, especially across, no matter how you're funded, if it's state funded, federally funded, embedded in those program guidelines states that we should be supporting the most at need, which include homeless families. That is a categorically eligible category. We should be supporting them, even though we know that some of them may very well leave, drop, or what have you, right? So we definitely have to balance as best as we can. You should also be transparent with us when we collect enrollment on a weekly basis, right? So if we see that you had 100 this week and then next week you have 40, your respective person who you report your enrollment to should be asking you questions. You should be reporting to us what's going on, so that when we report to the powers that be, so federally, we submit an enrollment report every month. We also give them a narrative in terms of why our numbers are where they are. And we're saying in that narrative, the reason why our numbers are the way that they are is because we are working with new arrivals. A lot of them have left, da, 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 da. And that's something that we support you on when we give the narrative to the larger powers that be, okay? The issue becomes when you're funded for 100, you're steady at 20 enrolled, and we have no context as to why. Especially if your daycare or your organization is not one of the organizations that I have on my list as working with New Arrival Shelter. So on my end, I can say for sure, yes, we have a number of you, I was going to name you, but I'm not, a number of you who I know for sure are in shelter. A number of you for sure have been recruiting at police stations. A number of you for sure have been working with churches. I know this information because you told me, right? So I can help support you on the back end by saying, you know what, Sheree's Daycare, they are only enrolled at 40, but you know what, I know for sure that they're going to be in Chicago on Saturday. They're anticipating 80 enrollments, you know, so we're going to work on them, da, 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 da. And that helps Saraytho make those decisions and have those conversations elsewhere.
Always important. Make sure that they're communicating what shelters we're working with.
Yes.
Right? Where our center's located.
I would appreciate all efforts, even if you're working directly with me, or even if you're doing your own new arrival homeless mission, right? So you may be working with a shelter that's in your area that may not be on this list that we just showed on the previous slide. If you could just report that to me, that would be fantastic. Okay, so again, my email address is there. If anyone has any questions about new arrivals, if you have any questions about categorical eligibility, because it's like, man, what can we accept? What can we use? They don't have this, that, reach out to me, that's fine. We can navigate that together, okay? Any other questions before I relinquish the mic for the moment? Okay, thank you all. Thanks. I'd like to thank my mom. You want the mic in hand, you want it? You stand back.
Good morning, team. Good morning, good morning. In your financial letter envelope, you guys will see, yes, ma'am? You raise your hand. You received also your under enrollment letter as a hard copy. Your under enrollment letter was emailed last week, but since you guys are here, I figured you want a hard copy as well. So I went ahead and put it in there for you. On my two slides, I just have friendly reminders. Please don't forget meal count. If you have any issues, I put the lovely data person who you can contact for data. I also wanted you all to know that that's that fun time of year. Everybody's excited about doing taxes. Okay, not like right now because everybody's excited about Christmas. or Kwanzaa or Hanukkah, but I'm talking about in January. I know everybody's gonna be excited about my PIR. PIR, let's say it, PIR. Yeah, so you guys got your worksheets and hopefully you guys are plugging away the information that goes in the PIR. And so if you need any help there, I have the dedicated person whom you can contact to get information to help you enter and finish your PIR. Next slide. Hair support. I heard, I've only been here 2 months, but I heard your concerns. You guys said, I need somebody to come and see me. So my data team is making calls and making appointments, and they're actually coming to see you. However, we are, and we're gonna start this in January, Thursday and Friday of every other Friday, don't worry, it's gonna be in the CSD Cares announcements. We're gonna have clinics at our office as well, so that you can sign up, and so that you can send, you know, a person, a new hire, whomever, for a CARES training. So be looking out for January's CSD updates. And I know everybody's famous thing, which is why I put it for last, because I know Fred's gonna come up here and rock it out. The budgets, yep, federal budgets, yes, they were due. Please send them in. State budgets, yes, this week, they are due. Please send them in. Just like to put out there, just as a mention, because I know my boss is gonna mention it to you all later on. EHS expansion, new grant, not continual. We will be asking you for additional information pertaining to this grant. Please be on the lookout for that communication. Any questions? Any concerns? All right, team, be here next month, same time, same date.
Good morning, everyone. I'm here to talk about the expenditure rates. As you can see, these are the federal grants. Ended in November, so we should be at 100% expended. Head Start, we're only at 61%. Early Head Start, 55%. Early Head Start CCP, 54%. Early Head Start expansion, we're only at 57%. We should be at 100% here. All right, next slide. With the state grants, all right, the ECBG, we're at 16%. CCAP, we're at 21%. We should be about 42% here. So we way below the mark. Make sure you get your invoices in. Next slide. COLA budgets are being reviewed and processed. You will be notified upon budget approval and can move forward with the invoice submissions at that time. Final invoice submissions are due no later than 1/24/24. Please delay any further invoice submissions until you are notified of your COLA budget revision approval. No invoice accruals will be accepted for FY23 as it relates to Health and Human Services FY23. FY24 award letters have been distributed and budgets were due December 6th, which that's passed. All right. If you haven't submitted them, please get them in ASAP. Follow-ups have been made for missing submissions. Please submit as soon as possible. You will be notified to submit your December 23 invoice as soon as your budget is approved. Finance will send communications regarding 23 accruals in January. FY24 childcare invoices should be submitted through November 30th at this point. Finance will reach out regarding FY23 invoice accruals in January. As it relates to PIPFA, invoices should be submitted up to November 30th of 2023. Award letters have been distributed for 5% COLA and to extend the PFA budget start date from 9/1 to 7/1/23. Budgets are due by 12/19. All right, 23. Please refrain from any further invoice submission until you are notified of your budget approval. Finance will reach out regarding FY23 invoice accruals in January. Any more? All right. iSupplier, make sure your insurance is updated in the system. Expired insurance will hold up your contract, invoicing, and payments. As always, the iSupplier training and reference material on the link. We have your finance contacts as relates to federal grants. You got Laverne, Teresa. The corporate RTL, Laverne, Teresa. CCAP, Selena. PFA, Laverne, Teresa. That information is the same. Okay, please get those invoices in, guys. So we have a certain date that we, all of the invoices have to be in, and we pay them at our Department of Finance. Sometimes due to late budget submissions and things like that, we can hold the funds for FY23 until we could pay from FY23 without affecting FY24. Correct.
Now for PFA and the contract you're changing, from my understanding from September to starting in July, there was something written for that with the COLA. Is that something that can be explained?
Yeah. I think Saraytho hopped up. So yeah, give Saraytho 1 second.
I heard correctly. Hello, everyone. So it sounds like it was a question regarding the start date. Restate the question for me.
Just for the PFA timeframe, we received something saying the budget period or the contract started in July instead of
September. Okay. Question about the PFA changing the start date from September, to July. One of the things that we had determined from going through talking to agencies is that there were many agencies or some agencies that were operating their program through the summer and paying teachers over the summer. Worked with CPS to find out whether or not we could then change the start date on our contract effectively to allow for that, because people weren't able to charge. We want to use the money. We want you to get paid, and we want you to be able to pay your teachers. CPS gave us the okay. So what came out for your start date now is a July 1. So you got July for PI and PFA and July for PI. So both of them are on the same start date. Yes.
Will it be a permanent change?
Will it be a permanent change? Nothing in this world is permanent. Except change. There you go. One thing we do know is there will be what? Change. And so I wish I could tell you that it's going to stay that way forever. I cannot. I had tried to get that change earlier. We finally got it changed. It could be overruled. It could be overwritten. And I will tell you, one of the easiest ways to get it done that way is what? Underspend. Because this was all about making sure people could spend their money, right? And if it comes back in and it didn't, and we don't see any effective change, then why change? And then we're going to be back at the table debating it again. I'm hoping that it will make a difference for those of you who do have your teachers on salary and you've been paying some part of that over the summer. I hope it makes a difference for you in your budgeting and your allocations and your ability to spend. And that was what it was for. Okay? Yes.
So just to confirm, we can now go back and bill for July and August.
He's going to verify that. That's what we were told.
Yeah.
Frederick's going to verify it. If there's any change, you will get something by email. Yeah, because that's what we were told, and that's why the contract has that start date versus the start date it had before for PFA, because it did say September 1 previously. Okay. Any other questions regarding that? Yes. Another 5% COLA did go out for PI and PFA. Yes. So I'm going to go and verify that. The question is, does the 5% extend back to July 1? Is that your question? It is part of the increase going back to July 1. The contracts were effective July 1. The increase goes back to July 1. Unless that is different, and I'm going to make sure that he verifies that. But because we have an IGA, the effective date on the IGA is July 1. And so if there's anything outside of what I'm saying to you standing here after a cup of coffee, I got off coffee for weeks and I just had a mocha. Probably shouldn't have done that this morning, but I did. But what we understand is when we do the IGA, before when your IGA came in May, for example, if we gave you something in addition, it went back retro to the beginning of the contract period. I'm anticipating the same for this. If there's any change, we will definitely let you know. I saw two other hands. Yours first and then, yes, ma'am.
If they told us is that 5% that we got is not enough money to retro back to everybody to July. With the COLA is okay to do it through September, but for us to go back, this is not enough money to retro all the staff back to July. So my question is, do you have to go back to July?
We need to look at that. We need to look at that because the 5% was a total 5%. It wasn't projected for a month or two. You got a 5% total increase. And so your budget should account for that. Okay, Frederick and I will work with that because when we went back and we were doing it, it was 5% over your total budget. It wasn't 5% for 10 months. So let's verify that. As far as the dollar amount, what we'll do is look at the dollar amounts that went out and to see and make sure that we understand what's going out the door. Okay. Yes. And I'm going to say yes, because at the end of the day, these are dollars that cover that period. And if it covers that period, the intention is for you to retro back to the beginning of the contract. Yes. And that's the question is, will we do we have to go back and retro? The retro is required. Yes. You possibly will, and hopefully you'll spend all your money.
Right, yeah. So, or will it be like a separate, you could just say like, am I pay it now? I don't know.
So let me say this, when you got the 10% increase, you got it at the end of a contract year. And what you were doing your retro and you were doing your billing. There's nothing different here except you got it earlier. Okay.
Well, it is different because you're going back 12.
Well, you're going back 12 months, but
What is what I say?
Yeah.
Change the calculation.
it's going to change your calculation. And if let me say this, if you want some one-on-one and we want to spend some time with it, make sure Jocelyn gets your information in the back so that we can work with you on this, so that we're not making any mistakes on any budgets going forward. Because I don't want anybody to lose a dollar and I don't want us to underspend. So let's work on it and make sure we've got it, especially your question about not being able to cover. Okay. Any other questions? Yes. We'll send back out an FAQ. Because I'm sure other people will have some of the same questions. Any other questions?
Great that we're getting ahead of.
Oh, thank you. I'm glad because it makes my life a little bit easier versus getting it at the end and then trying to make everything work in a couple of months. And so I'm glad that we were able to effect it a little bit earlier than we have in the past. So thank you. Yes. Another question. Yes. I can barely hear you. That's what we're going to go back and look at and do an assessment. That's the question on the floor is the amount that you have covering the 12. And we're going to go back and we're going to make that assessment and we will figure out what, if anything, we need to do. And we will get something back out to all of you. No. And I should have restated it so everybody could hear it. Oh, you're welcome. Anyone else? Yes.
So like, the amount that you already gave us, we'll have to budget for that. And then if you send another award letter or an increase, then we'll have to do a separate budget for that as well to increase it, right?
Absolutely.
So there's gonna be
If that's what we need to do, absolutely.
Yeah.
But I need to go back to fiscal because when fiscal was looking at the dollar amounts, they were looking at the year and I want to make sure that we didn't make any mistakes. Okay. Any other questions? All righty, I'm gonna turn it back over to Sheree. and let her go over health and safety updates. Thanks, everyone.
Hello again. On behalf of our Director of Health and Safety, B. Nichols, who could not be here today, I am going to, provide health and safety updates for you all. Can you hear me? Okay, great. Because you know I like to hold the microphone. Anyway, so we are asking that you guys continue reporting your COVID cases and using the COVID reporting form. So I know that the world is saying that, you know, COVID is going down, but we know that may not be true for all, right? COVID is still alive, COVID is still around, COVID is still here. So we're not asking anyone to downplay any illnesses that are impacting your operations. So be it COVID, RSV, what have you, please continue to report any closures or any illnesses that are in your sites or organizations. But in particular for COVID, make sure that you're using the COVID reporting form. Post-COVID, we should have resumed the following activities: family style meals, toothbrushing, hand washing, sanitizing, restocking of first aid kits, rotation of toys. These things should not be not happening, right? I should have said that differently, but we should make sure that these things are happening within your classrooms. And we received a lot of feedback from our team that have been going into your classrooms during our health and safety snapshots, during our overall operation snapshots. We've received a lot of consistent feedback across the board that not just one or two of you, but a lot of programs consistently are either hit or miss with a lot of those things that are listed on the second bullet, or some of you haven't done it at all. And a lot of you are saying, well, because of COVID, and I can understand that, you know, we're fearful, right? But we have to, as best as we can, return to some sense of normalcy, especially if within your settings, things are back to normal, meaning that there's no current COVID cases or anything like that happening within your classrooms. Then we should be trying our very best to push back to pre-COVID operations, okay? Are there any questions or comments or concerns regarding that second bullet? Fantastic. We talked about the third. We're also asking that your state and city licenses are current and report any issues with your monitoring team lead if you have any issues with getting those documents updated through our health and safety or through our snapshot visits. Let me just not label them as health and safety. Through our snapshot visits, we noticed that, you know, we're being very particular. We're looking at little things. We're looking at baseboards, but we're definitely looking at your board at the front where your licensure should be posted. And some of you have expired licenses. Oh, like, oh shoot, I have it, it's in my office. Please make sure that these things are posted within your sites, okay? CDPH encourages all eligible families to be enrolled in WIC. So there's a survey coming in 2024 for the WIC survey, WIC program. Also, just a little side note, it's not on this slide, but let me tell you guys what I learned yesterday was that WIC is also implementing mobile grocery stores, right? That's what they say, right? Mobile grocery stores where normally, you know, a family would get their WIC voucher and they can go to a grocery store to utilize the WIC voucher. But WIC is starting to implement a new program where they have like a mobile grocery van that will come to families. So there'll be designated locations where families can go and gather necessary groceries and such on these mobile grocery stores. So that's also coming rather soon. Prevent Blindness wants us to remember toy safety during the holiday season. Eye injuries are the most common cause of vision loss in children 0 to 4. That is terrible. I should be able to play and just enjoy, but we have to ensure that things are not implementing or hindering the vision of our littlest learners, okay? So we know that some folks think, oh, boys and toy pop guns, and I've seen this happen actually, where a little boy accidentally shot his eye out. He did, with a little pellet gun. It's just a pellet gun, it's harmless, but he took it, he did something to his retina, it was horrible. So we just should be mindful of, you know, not only within your programs, but talk to your parents about this too, because we know that a lot of folks, not even just the little boys, but, you know, for all children, ensuring that we're keeping them safe both inside your classrooms as well as at home. Are there any questions? Yes. Yes, we can send out the COVID form through a CSD update. As I'm looking at the team, they're not in their heads, yes, we could do that. Are there any other questions? Okay, I think that's it. Thank you. I'm trying to see what the next slide is. Okay, no, that's not me.
So good afternoon again. It's me again. I know you're just wishing Saratha would go sit in the back, right? So just a couple, of updates. I was at the office today because we have a new person that started today. His name is James Martin, and he was bold enough, you can stand, to jump in the car and ride over here with me. He's our new program analyst. One of the things, and we know this, we live in a world of data. And so everyone needs to be building out their team, as we do at Children's Services Division, thinking about not only what our data is saying to us, but data visualization, et cetera, et cetera, et cetera. And so bringing on someone who has that background was necessary for us with our team, and we are really happy he started today. You know, we tell people when they start with us, you never know where your first day is going to be. We had a couple of other people who started and we said, thanks for coming and doing your orientation. Now go to McCormick Place. The team is over there waiting on you. It's based on what's on our schedule, right? EHS expansion grant, and I heard Angel mentioning this when I walked in. Just want everyone to know that if you are one of those 5 agencies, what we did do for September 1 is we did meet the first obligation, was a continuation grant application. I thank you for submitting all your documents. That was great and good. But I want everyone to remember that this grant was awarded to us in March of 2019, which means it was time for a full base grant application. But to not stall everything, we did a continuation. Now we're required to do the base grant, and it is due in January of 2024. So we're rapidly getting things ready to make sure that we can get that grant application into Office of Head Start. It is a little bit different. It does cost for more information. And so we'll be working with those 5 entities to make sure that they're doing all of their due diligence as we are doing ours so that we can meet the deadline. So it's only impacting 5 of you, but I just wanted to put that out there, that my team is working on a base grant. It is a whole lot different than working on a continuation grant. And I see you sitting there. Welcome to my world, HBH. They are different. Calls for a lot more information. Monthly invoices, and I know you keep hearing this, but I can't say this enough to everybody. We can't keep up with what's going out the door if you're not keeping up with your invoices. We really need to internally be able to do our due diligence on our side to say where we are in any given month based on what was expended the previous month. And we're really not able to do that when invoices are not coming in. We're getting questions constantly about where are we? And every time we can't give the actual or even close because we have so many invoices that are not in. We have said before, invoices are required monthly. It's not optional, it's mandatory. You're getting monthly an information from us that tells you where you are with your expenditures. And the reason that we're doing that is 2. Number 1, to remind you that you need to be invoicing. And maybe you're not the person who does it, you're picking up the envelope. Please make sure that your organizational staff, fiscal person, whomever, understands where we are. If you are getting something today that says you're only 20% of something where you need to be 80%, that's a problem. That means there's a lot of outstanding invoices that have not made it through to DFSS, and we need your help in getting those done. How many of you recognize it as December of 2023? Which means Head Start ended November of 2023, which means some of you were saying that you're not 90% expended, so you obviously have a whole lot of invoices at home that need to be submitted, like in the next couple of weeks. Does that sound about right for you? Of course, nobody would put their hand up and say yes to that. I wouldn't expect you to, but I do need you to understand this. Underexpending is underexpending, and it's a problem. If we know in time, we can do something different. We can move dollars into other lines and make some discerned decisions about what we do. But when we can't do that, then we're stuck waiting to see what you need to do. Once we put the grant in your hands, what we try to do is leave it there, with an understanding that you plan to do what you put in your budget. If you're going to detract from that, if you're not going to spend all of your dollars, we need to be doing budget revisions. There are opportunities to do budget revisions and move dollars to other lines, but we should not be leaving it on the table and underspending. I understand part of it is staffing. I get that. But even if you don't have every staff position filled, some of you, from what I'm looking at, are paying money to an agency to have people come in your door. That is billable. And I know I had to say that to somebody. And she's like, I could bill. Yes. Why? Because they're staff. You're paying a bill. You're paying someone. You should be charging that to your grant. There's a line on there that says what? It's in your budget. It allows you to do that. You may need to move money to do it, but it allows for you to do that, right? How many of you in the last 5 years looked at your classrooms and made some decisions about needing to do some changes, putting in new equipment in classrooms, new manipulatives, books, et cetera, et cetera? How many of you looked at your programs and saw that? How many of you did that on your budgets and took care of it this year? Because Head Start ended. Pretty soon PFAPI is going to end. There's an opportunity to get that done what? Now, right? Your classrooms, and I know she talked about the snapshots, and they're coming back and talking to me about snapshots, and I've been out and I saw some too. It is 2023. Pretty soon it's going to be 2024. And I'm just going to say this, and I'm not going to say anybody in particular, but I can tell some things have been in classrooms for a long time. And when I say long time, I mean long time. And it's nothing wrong with saying it can go. It's nothing. How long? Too long. It's okay to let it go, people. It's okay. It's okay to upgrade. And imagine the children when they see new things coming in, how excited they get and how excited your teachers are going to get that they're getting new things in. But beyond that, when we think health and safety, if we've left things in our classroom for too long, they are probably an accident waiting to happen. I walk past and I can rub my finger on something and I can get a splinter in my finger. So could a child, right? I need people to pay attention to that. That's what the dollars are for, is to not only support one side of your work, but the other one as well. And what we don't see are those kinds of upgrades happening across the board in programs and in classrooms. And I'm really asking you to do that. Don't send the money back. Don't give it back to me. And then have me come and visit your classroom and ask you why you give it back to me. You could have done what with it? This is an opportunity for you to really look at your house, look at your classrooms, and make some decisions about what your needs are. I understand understaffing people, but what I don't understand is understaffing and not taking care of the things in your classrooms. If I walk into a classroom and I see enough manipulatives where children can have a great day, I'm happy. If I walk into a classroom and I go, there's 7 kids in here and 1 doll. I had 2 daughters and I couldn't have 1 doll in my house. Okay, it just didn't work. I love both my daughters, but 1 doll was a nightmare for me. Okay. And that 1 Barbie doll that was in that box when my oldest wanted to keep it because she heard that there was some value. I told her to put it on the right shelf because it was going to end up being the toy in her sister's room. And guess where it was? And we still talk about it. One's 45 and the other's 38. And we still talk about that doll. Okay. Have enough for everyone. You got 4 girls, 1 doll won't do. You got 4 boys, 1 truck won't do. Go into your classrooms and look, do you have enough of what you need for active engagement of your children? If your children have aged up, they need something new and different. Things need to go out and things need to come in. Are you doing that? Are you resourcing your classrooms that way? I'm going to get off my soapbox and tell you that I'm still going to continue to visit and I'm still going to talk about it to you, especially when I might come in with your budget in one hand and then a lens in the other. Okay, let's do what we can do in these classrooms. And let me say this, while dollars are available. Okay. Under enrollment. How many of you are under enrolled? It's okay to put your hands up. It's okay. It's okay. There is under enrollment. There's under enrollment across all of our funded programs. PFA, PI, EHS, CCP, expansion, and Head Start. We have under enrollment across the board. For the federal grant, we have a under enrollment mandate for 12 months. That 12 months ends November of 2024. We are going to constantly work with you about getting enrolled. We're going to be looking at sustainable programs and projects to get kids enrolled in program. We need to talk to you about your staffing because we know staffing is a part of it. But we can't give up the fight, people. We've got to find the families. They're out there. And if we're looking at data, guess what data tells us? There's enough children to be served. So the question we have to ask of ourselves is, what can we do differently, or what should we be doing differently to encourage and enroll these families? And that's what we're going to be working with you on. What else can we do to get these families in our program? We talked about SNAP, right? Being categorically eligible. The moment people started giving voice to that, you got more families enrolled. How do I know that? Because I'm looking at your data. It was working, and now there's a slump, right? So we need to do the other work, and we're going to work with you. We're going to build a plan, an overall plan, but we're going to also do individualized planning to make sure that we work with you to think through how we can help you have an active management, marketing and recruitment and enrollment plan to continue to enroll your programs. All right. And this is going to be a requirement. It's mandatory. Just because it's the federal, we're looking across all of our funding sources, and we're going to be talking about all of them. If you have multiple funding sources, we're going to talk to you about all of it, not just one. Meeting one means we meet it all, right? Anybody have any questions or comments about that?
It's not about that. Can you share anything about the expansion down with the PFA and PI?
No, yes, I will in 1 second. Let me finish this one. Learning agenda, let me do this quickly, and I'm going to come back to Scott's question. Learning agenda, January 28th, 18. We're going to change what we do versus talking heads. We're going to have a working meeting. And in that working meeting, we're going to be talking about child outcomes in class. We're going to have individuals here to work with us to talk about it. I'd ask you to invite your education folks so that they can be in the group so we can talk about it, and we can walk away with some ideas and things that we can do to ensure that we're increasing our child outcomes. I will tell you, on the federal side, when we looked at our kindergarten readiness, we did get it was a decrease. It went down a couple of points. We don't want to see that. What we want to constantly see are these scores increasing for children, that we're constantly getting more and more of our children ready for kindergarten. When they leave us, they should show up kindergarten ready. We've got some work to do, and we're going to be working with you on that. So plan for the January 18th meeting to have individuals, and I'm not telling you not to be here, but with you, bring your team so that we can work in groups and talk about and strategize. Any questions about that? Next slide is one other thing, listening sessions. And I want to make sure that everybody who definitely has a federal grant, that you understand that they are doing some additional listening sessions, but you need to understand that right now there is a process where we're looking at the current Head Start performance standards and making some changes. Some of those changes will impact all of you who have federal dollars. One of those that will impact everybody is this. For example, if it passes through, and I'm going to say this because I believe and I agree with it, I think all teachers, Head Start and PFA, I think they should all be paid commensurate with school district. Anybody in here don't agree? Okay. That's what your teachers deserve, people. They all deserve to be paid those same wages. If I walk into a CBO program and I am working with 3 and 4 year olds, or I'm walking into a CPS classroom, working with 3 or 4 year olds, I should be paid the same salary. We're asking for similar credentials. We should be paid the same. We've got to get past where we are right now, where we allow individuals who are working in these programs to have to go to public benefits to make the difference. And that's what's been happening, and we got to put a stop to that. So I will tell you, I believe that we need to get to that point. But I also understand that there's a lot that has to happen in order for something like that to occur. But I totally agree that we need to get to a point that we have salaries that are commensurate with degree across the board, that it shouldn't be one door or the other, and based on the one you go in, there's going to be this huge difference. We've got to fix that in early learning across our nation. Okay, so I hope some of you join my voice on that. But in what I'm asking you to do is do some of the listening sessions and understand some of the things that are being talked about that may end up in the Head Start performance standards and may impact you, for those of you who are operating under the federal dollar. Stay aware before a new one comes out and all of a sudden you go, I got to do what? If you didn't give voice to it, and if people didn't react to it, it becomes a standard. Okay. And people need to be giving voice. This isn't what you need to get into them. That link is right there for you. Next slide. So we have CARES training. We've had trainings for the last couple of days. it is considered a pilot. The reason we considered it a pilot is we wanted to work with our vendor to do a couple of trainings. They've been working on HR and professional development so that we could work with them on changing the training the model of training that they're doing. And so I've had staff in the trainings along with the trainers and agencies, and I thank individuals for having their staff there. And we're looking at that. People are getting the training that they need. It's not wasted. But what it is giving us is an opportunity to get some data and some information to help us work with our vendor to change what we need changed in our training as we move forward. Unannounced and announced visits, like I said, they're just gonna continue. We just have to keep walking into your house and getting up close and personal and talking to you. And I love seeing your kids anyway. I like it when I walk in, little kid asks me, where you come from? And in my head, being me is like, does he really want to know? He doesn't want that answer, right? You know, or one who looked at me and said, you have an ID on like my dad. Do you work where my dad works? You know, they are going to come up and they're going to engage, and it literally makes my day. And so we're going to be out there much more than we are, especially when we can have some gaps in our schedules where I'm not in meetings all day. This was actually taken at one of our visits, Trinity United. And so when we come, we do take pictures and we share those pictures with our board so that they can see what's going on in your house and in your programs. And so if we come and we take a picture, before we share it, we will ask, is it okay? But we do share things with our CCUO board so that they can see what's going on in programming. They'd like to know more about what's happening, and we try to share that with them. All right, next slide. I think it's go past that because I talked about it. Now we're at HBH's question here. He had his hand up first, and I'm gonna come over to you. I see you over there. And your question was about?
PFA and PI expansion out of the state.
Okay, so for example, talking about Smart Start, our governor decided that he would put additional dollars into early education. ECBG grant did get an increase. As a result of the increase that ECBG got, we've got an increase at CPS. CPS then increased us. What we did is we gave that 5%. That was a part of the increase that we got, right? We're also, for some slots, we did increase some slots where we knew that there was current capacity operational right now. And so we're still looking to see if there's some more opportunities for expanding slots, because this was about increase in expanding opportunities as well as salaries. Both of those were in what the governor put out there when he put out Smart Start. So we're trying to approach it as a both and, not an either or right now. One of the things that we knew we needed to do, the 10% didn't get people there. We had an opportunity for 5% more. So we added that to the grant. That still, I'm gonna tell you, doesn't get us there. And the reason I say that is CPS got another increase as well. And so they get an increase. We give you one, but yours, we're always trying to catch up. So we still aren't where CPS is, but we're going to continue to work on it. But we did look at that, and then we're looking at other ways that we're using the dollars at DFSS. One of the other things that we're doing, let me finish this thought. One of the other things that we're doing, because we want more of your staff to get opportunities for scholarship, because we need more people to get their credentials and their degrees so that you can then have more qualified teachers. So we did put more money into scholarship. So we got to put money where our mouth is. If we're saying these are the things that we want to do, we need to use our dollars for exactly that. So that's what we're doing with our dollars, is to make sure that we're able to align and think about the things that's going to have an impact for you. It's what are we going to do with these dollars is going to be meaningful on the ground. We knew an increase was necessary. Get another one, another increase is necessary. We know the salaries are not there yet. Some of you, and I thank you, those of you who've been able to meet those dollars because you have multiple sources of funding, I'm happy about that. But that's not 100% of who is serving children in Chicago on our grants. And so we know we still have some work to do, and we're going to continue to do that. The dollars from Smart Start were for 4 years, so this is just year one. There's a year 2, 3, and 4 where there will be additional dollars. There's discussion about where those additional dollars and how those additional dollars are going to go out. Also, as I'm not sure how many of you know, and I'm asking everybody to keep your ears to the ground. There's also a new department being created in the state of Illinois. And a lot of decisions and things are going to be made within that house once all of that is developed. It does have to go through legislature because this is not a division, this is a department. And so they have to go all the way through the approval of legislature to allow them to start a new department. And that's what they're asking to do. But a lot of those Smart Start dollars are going to come under their auspices and their control. Okay, did that answer your question?
Yeah.
Okay, you're welcome. I saw your hand and then I'm gonna come back over. Yes. Okay. Okay, thank you. So the question is, we're catching up with, or the statement, we're catching up with attendance in CARES. Thank you for that. Will you need to continue to send the weekly? Yes, until everybody is, because my staff needs a report to send. And until I can get everybody actively doing it in CARES where you're enrolling, doing all of your reporting, doing your attendance, et cetera, 100%. It's hard to say, go in and figure out which ones are doing it here and then figure out which ones are doing it there. It's too hard. I don't have a team that big. I only have a few people. And so what we're asking is that they continue to reach out to agencies so that we have it in one place. And then I have staff behind them actually doing calculations and helping get those reports done. I want to get away from it as much as you do, but we're not there yet. Okay? You're welcome.
So mine has to do with PI expansion.
Yes.
So earlier this year, there was a conference speaker right for like 50 PI further.
Yes.
Was that part of the expansion?
No, doula was in the current contract. We didn't expand. Let me say this for those of you who didn't apply under the other one, I'm doing a repost of doula. Yes, I wanted to say it out loud, out of my voice. It's coming out at the end of this month and closing early next month. I can only leave it out there for a short period of time. Okay. And so it is going back out so that people get an opportunity. I will do some other emails and make sure that we're reminding people that doula is coming out. There are two that are being reposted. Health and nutrition is being reposted, and so is doula. Health and nutrition is being reposted because we had no vendor. And so if there's vendors that you know that you want to provide health and nutrition to your people, let them know that it is being reposted and you want them to apply so that they may be a possible vendor for you. We have to, by federal standard, we have to do health and safety, right? And which part of that is having a health vendor. We need to have that on. We need to have nutritionists who are working with individuals. So if you got some ideas, talk to people and let them know it's being reposted. If I can remember correctly, it's being posted, reposted on December 29th. Okay, I believe that's the date. So just look for things around that week. At the end of December, I believe it's going out December 29th. And both of them will be reposted at the same time. No, you haven't missed anything. No, Cerrato's crazy busy. I'm working with contracting to see what all they need in their system. Our IT side, as soon as we get that done, I think the plan is to get that done today. Then we can put in the EA or the executive approval, which then can push out contracts to those who we intend to fund.
Will it be done next spring? If we don't know, then we might try it again. You know what I mean?
Yeah, it's gonna, the goal is to get this out as quickly as we can. Talk to me after the meeting. Anybody else have questions? Yes, ma'am. Oh, yeah, it woke me up at 3 o'clock in the morning because I meant to tell somebody here to bring it with them today. And I actually fell asleep. Who knew?
What was her question?
It's about the document about credentials that hasn't been pushed in through my email box. And so my intent was to get in touch with Jocelyn and say, Jocelyn, print them, have them at the table so everybody could get them. And so Rachel woke up with this vivid thought of getting it done, and then she went back to sleep and then had to get to work when she woke up. So you're getting it today. Okay, you're getting the information out today about credentials. Yes. So I apologize for the delay on that. What other questions do you have for me today?
Is there a published document that tells us what commensurate wages are with CPS?
What we put out the last time was what we got directly from the CPS system on where their salaries were, and we can do that again. Yes, we can send that back out again. Jocelyn, did you make a note of that? Thank you. We'll push that back out again. And there's been a change since the last one. It's been updated, so we'll make sure we get that and send it back out. And the question was, is there anything with the commensurate wages for CPS? We put that out when we did the 10%. We will put that back out again so that everybody has it. So we will push that back out to everyone. Yes. Assistant teachers. In the CPS system, if they're looking at the teachers, and that's why you see that. What we need to do is talk about where we believe assistant teachers need to be in Head Start or PFA classrooms. I know we put some of that when we did our RFP, and we've been trying to hold people to that. But we also need to be thinking about where they need to grow to. Okay, and that's some work that we need to do as a group, to be honest with ourselves about what it is we're thinking. Because if we're trying to build a model, we need to be thinking about what needs to be included in that model. Okay? Yes. When we put it out there, we will put it out for PI as well. We'll show you what we can find. Remember, we do PI, CPS doesn't do PI. So what we can do is give you what we know about salaries for teachers with certain credentials. Okay? You're welcome. She wants information on credentials and salaries. And so we'll get something out that will be workable for PI programs as well. Yes.
Any possibility that there may be a cost per child increase for CCP?
That's why he sits in the front of the room, so that he can ask me all of these pointed questions. His question is there any thought about doing an increase in cost per child for CCP? Absolutely. In order for us to do that, as you know, we have to do what? We'd have to write to Office of Head Start. In order to do a increase in rate, we have to do a decrease in slots. There's no other way to do it. Can't go to the Office of Head Start and ask for more money. It's not gonna work. In order to do it, you gotta give up something to get something. And so that's what we are in conversation about, that grant right now. Okay? Anybody else? Yes, and then yes. See, you guys both got them up, but hers was just a tad quicker than you. Yes, ma'am. Oh, okay. Okay. Yes.
And in the past years, I've seen an increase in children with disabilities in our center. I'm sure that. Has DFSS ever thought about those centers that are over the 10% providing an increase for services for children with disabilities that we can use for paraprofessionals that we love?
I was waiting on you to get there. I knew it was coming. I knew you. I knew it was coming. And that was our approach previously in our dollars. When we had more money, we were giving people paras because we knew you needed those extra hands in classrooms. And that was our help agent. When we didn't have those dollars, we had to pull back on that, right? I don't have those dollars right now. I wish we had the dollars to be able to say, I'm going to put a para in everybody's classroom. I simply don't have those dollars. But I want us all to think about what are the needs of children and what's the need in your programs. That's a conversation I think we just need to simply have and figure out when we're thinking about what we're doing, just what are those needs in program and how do we meet those needs? In most cases, I'm going to tell you, it won't be a cost per child rate. I don't have the ability to do that in most cases across the board. It might be something that we supplement. And what is that thing that we might need to supplement? We need to talk about that and figure out what that might need to be. Okay. Yes, ma'am. The salary guidelines have changed from cells, yes, and they changed because we've done increases both in Head Start and we've also done increases in PFA. And what we're trying to do is get a higher rate across the board or higher salary across the board. We're right now, every time there's a change, just like you're asking about credentials, there's health and safety information that has to go in there. And so we're working on cells as we speak, the update of cells, to put all of those updated pieces of information in there so that you have it right at your fingertips. Any other questions? Three comments. Come on. Let me do one thing. Sorry. I want to bring closure to a conversation before it begins. Yes, there were listening sessions, correct? Listening sessions regarding early childhood block grant. Those were put out by Mayor's office. And those were listening sessions that I participated in as a speaker, did not participate in any of the rooms. And so I'm not there with all the information that was happening. I will get a report. Once those reports are out, then there will be a follow-up to the listening sessions regarding early childhood block grant. And there's a follow-up listening session that's going to happen in January, and it will be happening in January. Well, it will culminate all of the information that has been gathered over these 3 different sessions and everything that everybody is putting through in the survey. Okay? That's the information that I have to share about listening sessions. More to come on those. Got it? All right.
Okay, so not to beat a dead horse, but I know that we just had some questions about the 5% COLA for PFA-PI. So immediately Frederick got on his phone and started texting the team like, okay, wait a minute, they're saying some things going around with these worksheets. So some reminders that we received from our accounting, finance team, fiscal team, they're stating that in the worksheets that you all receive for your COLA increases, ensure that you're putting in the correct amount of pay periods. So a lot of folks may be defaulting to the number of pay periods in 10 months versus the number of pay periods in 12 months. This is information that you would enter in, okay? The same would apply to the total annualized COLA amount that's in column 8. Make sure that you're putting in the total amount annual for 12 months, not just 10 months. Okay, so a lot of the calculations that are built into your worksheets is based off of what you're putting in. So make sure you're putting in accurate data according to a 12-month period versus the 10-month. A lot of us are looking at our previous budget documents as it relates to PFA-PI, and you can't copy paste that information because of course your previous is going off of the 10-month cycle, okay? Now there may be some error. I'm not saying that it's 100%, but that's just a surface level what our fiscal team is reporting back. Again, as Soreto mentioned, if you have any specific concerns, you know for sure, like, oh no, I know I put in 12 months. Oh no, I know I put in annual for 12 months, then absolutely, please reach out to Jocelyn. She's in the back of the room. Angel is also in the back of the room. Make sure we have your information so that we can work with you directly to support you as you're completing your budget documents for your COLA. Okay, that's one. Number 2, we did have an HR pilot for CARES. Did anyone in here participate in the HR pilot? Wonderful, hooray. Not you, Leah. Anyone outside of DFSS, but that's great. Okay, so I did see an agency. So those of, okay, so those of you who participated in the HR pilot, you were in there, you were navigating, we appreciate your feedback, use HR, okay? So if you have not started entering in your, I know, don't scrunch up your face. If you have not started using the HR module in CARES, you've been through the pilot, you've seen it, please start trying to enter in your information because again, our overall goal to get away from these spreadsheets and all of this manual data collection, we have to get into our CARES system, okay? So if you're having any issues doing so, immediately let us know, but we have to start, once we're going through these trainings for these different modules, please make sure that once you go through the pilot, start using it live. Yes. Yes.
So with that being said, after the integrator, that's something that they can get to.
Mhm. Look, Angel's looking, Angel's got you. Mary Crane needs some additional support. We got you. Okay. Like the team is really on it. Not to say that they haven't been on it before, but we've just been within too many things that everything was a priority. We are working more effectively, efficiently now to support you through this because we know without that support, there's no way that we can move the needle to get us where we need to be. So it's noted, we got it, we will follow up. Thank you for voicing that. Any other questions on that piece? I only got one more thing. So Soreto meant, I said any more questions? I didn't even look to see if anybody had a hand up. Did you see that? It's like, any more questions? I'm supposed to see if my back or I'm not even looking, but any more questions regarding that? Oh, as I touch the screen. Last thing. Who do we talk to for information changes in CARES? What type of information are you changing? Are you changing the classroom? You changing some staff? Are you site information? You can reach out to our data team. Angel has her hand up in the back there. You can see at the table. Stop by her before you leave. And depending on the level of concern, she can guide you on which way to go with getting those things corrected. Yes, ma'am. Mm-hmm.
Somebody named, I don't know who it is here, Alberto Chavez, that's been working with me in CARES. I've sent him so many emails. He's very responsive and very helpful. Like this, pay my account fee, he'll help me with that. So I'm thankful for that, and I've heard him talk.
Sure.
Appreciated for the work that he did.
Alberto Chavez. Oh, and he gets a hand clap. He is not here today, but he is a part of our IT team at DFSS. He is very friendly. He helps us internally as well. Normally when we reach out for anything, my cord is kinked. Oh my God, I have a short. He's like, oh, hi, I'm right here. I'm Alberto. Hello. He's very sweet. I do voices too, sorry. But yes, we'll make sure that he is aware that you have sent him some kudos and accolades. So we will let him know. Any more questions before I say my last thing before our deputy comes back? The last thing I want to make mention of, Saretho mentioned a learning agenda for January 18th, the EDPD meeting that we have coming where we'll be talking about outcomes. Yes, we will. But we also will be doing more intentional work regarding your incidents and incident reporting. So I just want to send a big resounding round of applause to all of you who have been consistently reporting your minor, mediocre, moderate, major incidents, because a lot of that information is very helpful to us so that we can for sure provide additional support to you. A lot of you have just been reporting, Sheree climbed up on the step stool to wash her hands and then she turned around, she went, whoa, and she fell. No injury, no hospitalization. We put on an ice pack, we good. I need that, okay? Or more severe things where Sheree was ill and you had to call an ambulance and mom, we met her at the hospital. I need to know that too, right? So I would like to remind those of you, because there are some of you who we fund federally and we also fund you on the state side. And I get so many incident reports from you on your federal side, but nothing happens on your state side. And I'd like to think that none of your children are clumsy and nothing happens, but I know that's not true. It is not the same children. He said it could be the same children, maybe. But most folks, when you're completing your incident reports, and we're going to talk more about this in the new year, some of you are telling when it's a blended child. You'll say EHSPI. I make record of that. But some of you are just flat out saying, oh, this is just my EHS child. Well, no, we need to know on both sides of the coin, both sides of the spectrum, when incidents are happening in your locations, okay? Minor, moderate, major. Let us know, because what we'll be doing in the new year is I'm going to show you some data that we've collected so that we can collectively, we're not just asking for this information for the sake of it. I want to report back to you what we've gathered thus far, what's happening. We need to have transparency because yes, you know what's happening in your houses, but you don't know what's happening at your table mate. They're sitting together. They don't know what's going on with each other, but we're not, without going too far into specifics and PII, we're going to talk about incidents collectively. And I need everyone on board with that. But in order for that to happen, report both your federal and your state incidents.
In real time.
In real time.
Same day.
Same day reporting. Same day reporting means even if you just pick up the phone and say, hey, Sheree, this happened. I'm completing the incident report. It's coming soon. Hey, Jacinta, an incident happened. I'll send the report soon. Hey, Raven, an incident happened. We're sending a report soon. That is same day reporting. You told us, even though you have not sent the form yet, I am anticipating the form. And that's same day reporting. Okay. Any questions on that? More work will come in the new year, but I just want to make mention to those of you who are funded on both sides. Those of you who are funded on state side, you're doing phenomenal. Like, man, I'm getting so many Band-Aid little incidents. Little Jimmy didn't trip on a little tricycle on the playground. I want to go to the playground and just see what he's doing. Like, well, how did you do that? Okay. That's all I had. Thank you.
She loves applause. Give her an applause. Just a couple of things. Ken reminded me, one of the things we had said before is that in our health and safety module that we were making it available for PFAPI, it is available. And so we need you to make sure that your staff are signing in, signing on, and taking the health and safety modules. If I looked at it correctly, there were about over 700 people in the module when I saw the report this. Over 1,000 people. Woo! That are in taking it. What does that mean for us? What does that mean for you? What it means for us is that people are actively learning about what is required of them regarding health and safety and what their requirements and responsibilities are. For example, you know, when people say, for example, I know I did that mandated reporter thing because they told me that I had to do it, but it was after the training that I really understood. I really am supposed to tell somebody. Who knew, right? And that was the purpose of even doing it, is to be that reminder and that voice to make sure people understood what our requirements and our responsibilities are for keeping children safe in our programs. And so I want to thank Ken and his team again for putting together the module. And I want to thank all of you for making sure that your staff are participating in it. And again, for federal and now for state, it is open and available to you to make sure that everyone is taking those modules. And I'm hoping getting something out of it, learning something. Please get those certificates and put them in your files, because that is going to be a piece of documentation for you that your staff have actually done this, okay? Any questions about the health and safety modules before we get ready to close for today? Yes. Thank you. Great, great. No, it's not. Thanks for saying that. What she's saying is that in going into it, it isn't just about reporting, it's about incidents, that there's resources that she was able to take down and print off from that system, and that there's a lot of information in there. And I'm hoping all of you will take an opportunity to go through it as well. Your staff, yes, but you should as well. Why? Because if you're holding somebody accountable for something, you need to know what you're holding them accountable for. And make sure that everybody's on the same page. Have your board do it. Why not? They have the fiduciary responsibility for your organizations. They should understand what all of this is as well. Okay. Are there any questions about anything that we've covered today? Reminder, in January, we're going to go to a learning agenda, and we want to do work together, not just talk to you. We want to do some work. So have other individuals with you as we're able to stage ourselves and begin learning agenda starting in January. I don't want us to keep doing this. I want us to work together. So I thank you. I thank you. I thank you for spending time again. I hope you enjoyed your muffin. If you didn't get one, I got one. It's cranberry. I love cranberry muffins. I don't know who knew. But again, thank you. And I know you're taking time out of your day every time you're here with us. And I just want to thank you, thank you, thank you for doing this. All right. Thanks, everyone.
Okay. This one.